Hello, this is Paul Swider from RealActivity, and I have Brian Smoker from Dartmouth Health joining me this afternoon. We're going to do a quick overview of our product offering, the Provider Experience Copilot. First, just a little bit about RealActivity. It is worth noting that we've been strong supporters of the Microsoft technical community through the MVP program, MCT program, RD program, and also some of the folks on our team are certified trainers. We've actually worked closely with teams at Microsoft training internally as well, including the healthcare and HLS team. And so that's a little bit about me, a little bit about the company. And now Brian's going to introduce himself and talk a little bit about how we got to where we are today, what started this journey, if you will.
Thanks so much, Paul. As Paul said, my name is Brian. I work at Dartmouth Health, and our relationship with RealActivity really goes back over a decade now. About 14 years ago or so, we had a project that came out of the Office of the Presidents, and what they wanted was to be able to see a data set that was fully transparent on MD FTEs, the various types of FTEs, not only the clinical, but also the admin and the program directorships and the contracts. They wanted that all to be put in one location, where then we were able to really drive performance metrics, drive billing, drive the clinical enterprise with that. And I really say over the last 14 years, really, that single source of truth has been a foundation of knowledge for Dartmouth Health. Certainly, we use it for compliance in the leadership and administration and finance area. Certainly, you use it for performance metrics. The MDs are able to see their data. And I will also say that one of the things that the RealActivity process does as well is it keeps the human in the loop. So like the MD actually sees their information and signs off onto it. For us at Dartmouth Health, that was extremely important that they're able to see this. That helps with a host of things. One, they know exactly what they need to do. They know exactly what their opportunity for performance improvements are. It prevents burnout because they know what their allocations are. And all those three things in one location has been extremely helpful to Dartmouth Health. So I thank Paul and the folks at RealActivity for the last 14 years for being able to partner with us.
Thank you, Brian. I appreciate that. It means a lot to us. And we're excited to take the great work that we've done and productize it and now help others. And so if we were to dive a little bit further into what this looks like behind the scenes, you can imagine when Brian was talking about the complexities of pulling from the different systems in the hospital. And by the way, at this time, we should note that we're not talking about clinical data. So one of the things that's really important to understand is that our Copilot and our activity reporting platform 100% addresses the administration and operations side of running hospitals and hospital systems. And it's actually for that reason that we complement perfectly the nuanced DAX Copilot. So while DAX is focused primarily on clinical use cases, note-taking, speeding up provider processes, et cetera, we pick up where they leave off on the administration side. And so essentially we do that from pulling from many systems across the enterprise hospital. And then what we did to turn this into a product through Founders Hub is we took the Microsoft Copilot stack and the open source semantic kernel, and we essentially took and we put a Copilot on top of the 10 years of work that we did at DH. And that's how we got to where we are today. So the Physician Experience Copilot end-to-end, it drives revenue for Fabric for OpenAI. So we connect to OpenAI in the customer's tenant and consume OpenAI services. We also implement our platform as a series of plugins. So it doesn't matter to us if the customer, the hospital, wants to use our Copilot chat interface or the Microsoft 365 Copilot. We can easily connect the Microsoft 365 Copilot to our plugins, our platform, and provide a single interface, if you will. I believe we should be able to do this with DAX as well, if they're following the plugin model. Brian had mentioned our attestation process. This is how we keep the provider in the loop. So we give them a chance to actually look at all of their activity throughout the organization. We call these activity slices. They can do a visual check. They see the activities listed out and listed as a percentage of their overall effort, their time. This is a little trick that we use to get compliance on the forms and provide meaningful reporting data back to leadership. So also there is the provider services component to this. So this is this is 100% a platform. So we have the RealActivity provider experience platform, and then the provider experience Copilot that sits on top of the platform. And so what you're looking at here is some of our administration screens to manage the feeds across the hospital. And then this is our Copilot. So you can see, again, we put the Copilot on top of the platform, and then it just lights up. It really lights up the platform. Essentially, what we learned is the best approach with Copilot for creating product is to take something great that you already have and then 10x it with the Copilot experience. And so that's exactly what we did. 14 months ago, we pitched to Founders Hub. We said, hey, we would like to take this work at Dartmouth, port it to the Azure cloud, and bring it to other hospitals. And we were accepted into the Founders Club. We were put on level 3 because we already had a product and a customer. Well, then what happened is we found out about Copilot. So we put the Copilot on top of it, and we 10x that body of work that we did over the past 10 years. And so we're excited about that. And you can see it's not only can you query and ask where the providers can ask about their own FTEs, but also just asking generic information like how can I improve my relative value units, which translate into how the providers get paid. And so with that said, I thank you for your time, and I look forward to continuing to work with the team at Startups. Again, I can't tell you how much this has meant to us, and I look forward to a huge successful year coming up. Thank you.